So I've been invited just to share with you a very short poem, which I'll do in a second, but I just wanted to say a few words to say what a privilege it's been for the last year working at LPT for me, working with some fantastic people, as Cathy's just said, seeing at first hand some fantastic innovation and superb care through some really difficult times. So it's worth just restating that and saying a big thank you to everybody over the last couple of years. There's a narrow strip of birchwood by a busy railway track where the blackbirds sing superbly and the trains rush there and back. So I wander in the birchwood with the burdens of the day till my peace of mind takes over and all burdens slip away. There's a glory in that birchwood, seldom seen and seldom known, to the folk who trundle to and fro, for cash they'll never own. It's the glory of the sunshine and the glory of the rain, the healing of the scars of life, the easing of our pain. But it's not the birchwood that heals us, nor the sunshine, nor the rain, nor the blackbird singing blithely, nor the rushing of the train, but the healing of community when wounds are deep and sore, and the human hand of friendship and the warmth of love once more. Thank you.
Thank you, Mark. The people working in our trust and our patients come from a huge variety of ethnicities, religion, and belief communities. And yet, in almost all life stances, there is an emphasis on caring for others, especially those in need. And often this is called the Golden Rule. So I'm going to read for us this Golden Rule as it's known, as it's found in many different faith and belief traditions, including non-religious beliefs. This is something that unifies us. From the Baha'i faith, lay not on any soul a load that you wish not to be laid upon you, and desire not for anyone the things that you would not desire for yourself. Buddhism, treat not others in a way that you yourself would find hurtful. Christianity, in everything do unto others as you would have them do unto you, for this is the law and the prophets. From the Hindu tradition, this is the sum of duty. Do not do to others what would cause pain if done to you. Humanism. The ethic of reciprocity means that we believe people should aim to treat each other as they would like to be treated themselves. Islam. Not one of you who truly believes until you wish for others as you wish for yourself. Jainism. What is hateful to you, do not do unto your neighbour. This is the whole of the Torah. All the rest is commentary. In Sikh, no one is my enemy, and no one is a stranger. I am a friend to all.
Personally, I found all the new phrases and words rather overwhelming. And new learning became a daily event about how to keep our patients and our staff safe. And we all have our own personal stories to tell. Being the main carer for my mother and trying to keep her safe with a complex long-term lung condition added another context for me. But one key phrase has stuck with me, which is that we are all in this together. And the idea that with kindness and compassion for each other we are stronger became a reality. The way we work changed overnight, and together we transformed the way we provided care to ensure the safety of our patients and our people. I also want to reflect and acknowledge the vital role, not just of our wonderful clinicians, but also for all of our other support staff who have supported our clinical teams to deliver safe care, keeping our hospitals and sites clean and safe, and all our administration colleagues in ensuring the effective running of our business. Every day, our amazing people work to provide high-quality care and treatment for our patients. While COVID has taken a bit of a back seat in terms of newsworthiness recently, it remains at the forefront of the national consciousness, and we are now looking towards the future. Thank you for your continued kindness, professionalism, and compassion. Thank you.
Thank you, Anne. I'd like now to hand over to our Trust Chair, Cathy, who will share how we've been doing in this Trust and conclude with some final remarks. Cathy.
Firstly, I just want to say our Chief Executive, Angela, would have loved to have been here with you today, but unfortunately she is at home with COVID at the moment, and we wish her a speedy recovery. So today we have all reflected on the journey of the last 2 years. It's important to recognise the challenges and difficulties and what we learned during this time. We have reflected on those we have lost personally and remembered those from our LPT family too. In March 2020, we saw the arrival of COVID-19 in the UK. 2 years ago, on the 23rd of March, the country was placed in lockdown for the majority of the year. Not only were we trying to manage this personally, but the pressure on the NHS was incredibly challenging, something that none of us in the NHS have ever experienced before. We said at the time that this was going to be a marathon, not a sprint, and it has definitely been the longest of marathons. I'm pleased to say that everybody at LPT rose to the challenges we faced, and we found solutions very quickly. This really supported the safety and continuity of care for our patients, service users and carers, right from the start of the pandemic, throughout the 2 years, and this still continues very much today. Angela and I are so proud of our staff in LPT and the incredible contribution that each and every one of you has made every single day. You have truly stepped up to great, and we thank you very much from both of us. We feel that COVID-19 has brought our LP teams even closer together, and we've seen real strength and resilience right across our trust. We've all had to adapt not only to different ways of working, but also in our personal lives too. At work, we've moved to more virtual working, with some of our staff working from home. Technology like MS Teams has enabled us to keep connected, but we really have missed that personal contact. All of our teams adapted to wearing PPE and enhanced infection control measures to keep themselves safe, as well as keeping our patients and service users safe at all times. And perhaps the most difficult of all, the impact COVID has had on our personal lives. We weren't able to spend time with our families and friends, and we were only able to go out for a little while for essential reasons. And if you remember, we endured this for many months at a time. I'm really proud of what we've achieved together in LPT. Lots of great examples. The creation of innovative service models at speed within mental health, community health, and for families, children and young people. This includes the Urgent Care Mental Health Hub, the Central Access Point, our virtual wards, and the enhanced digital offers that we have introduced for virtual consultations with patients and service users. We held listening events for our BAME staff to ensure that their voices, anxieties and fears were heard. They helped us to address concerns and find a way forward to ensure that their safety whilst working through these times was paramount. Both LPT and our colleagues at NHFT are committed to being an anti-racist organisation, and we are working really hard to drive this forward together. We did risk assessments for all of our staff to keep them safe, and we held regular listening events to ensure that they were supported at all times. We kept our staff updated with regular news from our comms team on COVID-19 information, as well as national, regional and local guidance. For us, staff wellbeing has always been a priority. Wobble rooms were set up with support and resources. This was a space for staff to take time out when it just got too much. Thank you letters and cards were sent to both our staff and their families, and staff received a special rainbow pin badge designed by Amy Crayford. We said thank you to our staff with a wellbeing voucher and an extra half day's annual leave. The Incident Coordination Centre and all the cells from across the clinical enabling teams that reported into it have been instrumental in translating national guidance at speed to keep our staff safe and supported. The rollout of the COVID-19 vaccination programme has been truly remarkable. Our staff and volunteers across the Trust have been phenomenal to the success of this. We have ensured health and social care staff and our local communities have all been protected by the vaccine. We have run big conversations to help us with our road to recovery. We're focusing on the areas that you've told us will make the most difference in helping us to reset and rebuild, learn from what's worked well and build forward for a better future. So I just want to close today's event by saying a huge thank you to everyone in LPT for their exceptional work in the pandemic period. I'd also like to thank our local partners in GP surgeries, UHL, ambulance staff and social care staff. This was a time of mutual support and partnership working. We came together and we met the challenges of COVID together. It was also a time when the public expressed their thanks to our wonderful NHS and key workers. I certainly felt very emotional every week at 8 o'clock when people were clapping. I was out there in my street doing the same. Not only did our NHS staff and key workers receive applause, but people donated millions of pounds. I want to thank Captain Sir Tom Moore for being a hero in this fundraising campaign. He has left us a wonderful legacy in the NHS. In LPT, this money came to our charity Raising Health. We use these funds to support the wellbeing of our patients with single-use activities and support our staff with wobble rooms and upgrades to our staff rooms so that they can take a break somewhere comfortable. We've also created these beautiful reflection gardens, one here at Loughborough Hospital and one at the Evington Centre. And there are 10 rainbow benches like this one spread across the Trust in Leicester, Leicestershire and Rutland. These are all lasting legacies for our staff to reflect on the time that has passed. Together, we must move forward now, continuing to support each other with kindness and compassion. Thank you for everything you've done over the last 2 years and for everything you're doing now to recover. Thank you.
Thank you, Cathy. Thank you to everyone who has attended today and to those who have helped plan and shape this ceremony. Thanks especially to our communications and fundraising teams for their help, to Dr. Louis Sava, our community chaplain, and to our volunteers. Thank you to those who have donated so generously to make today happen too. And thank you to everyone across the Trust for the work you do every day in serving our patients and our communities. Take care and goodbye.